and end-of-life care. And we need to understand health policy. Health policy, all these government policies and organizations' policies affect our practice. And we have to understand them, know them, and understand how they can be informed and changed through our practice. How to teach? We need to teach in college. We need faculty that can move easily from an academic to a clinical situation. We need to teach in areas where, in academic institutions like universities, primarily we want to educate nurses there, and also we need to teach not just in the acute care setting, in clinic, but we also need to teach in home and community-based settings where patients are and live. Faculty action. I want to quickly switch now. I'm trying to go. Am I going fast? Do I have some time? 10 minutes? Then I'm going to go back and saying what faculty, oh, okay, sorry. I want to quickly talk about PhD education because I've mostly been involved in PhD education of late, and we don't have essentials documents like the curriculum suggestions we have on the undergraduate level, but we do have these recommendations for PhD programs in nursing. And one of them is that you need a strong curriculum, of course, to drive the program, and you also need seasoned research faculty to mentor and support students. So we have a shortage of PhD-prepared nurses. About 1% of nurses in the United States have a PhD. We need also the institutions where these PhD programs exist. We need a commitment, a big financial commitment from them, because we need the infrastructure like libraries and the informatics and technology, and we need a research, Office of Research that helps to write grants and to submit grants and to support grants. And we also need money to support students, because it's very expensive for students to come out of the workforce and to start their PhD education, which sometimes takes anywhere from 4 to 8 years, and some people longer than that. Some of the challenges in PhD education are, of course, that we're a relatively new discipline in nursing. PhD programs only started in the 1930s, where PhDs in other disciplines developed in Europe almost in the Middle Ages, right? So we don't have a big track record, so we're still sort of finding our way. And we need to know what kinds of undergraduate nurses to recruit, who's going to be successful in these programs. And we don't know how many, sometimes we wonder about how many credits do they need in order to learn to be researchers. Do they attend, can we have full part-time programs, full-time programs? Do they need clinical experience? How much? And how can we develop these interdisciplinary courses? We know if we want nurses to do interdisciplinary research and work on interdisciplinary teams, that nurses have to be educated with other disciplines. We don't want nurses to be in a silo. I recently did a study because I'm on the PhD committee and we have a number of these questions. How do we best teach nurses to be researchers and scholars? And I wanted to know how well in the United States we were doing at producing researchers and scholars from PhD programs. So a colleague and I set out to do a survey of graduates of PhD programs. And we first had to recruit universities that had programs, and then we had to recruit the graduates in those programs. So it was a difficult recruitment challenge, and I'm sorry to say we don't have a large representative sample, even though it was randomly selected. These are the outcomes from the PhD programs in the United States. So of the people that have graduated from, with their doctoral degree in nursing, 16% of them have gone on to postdocs. Now, we're really pushing postdoctorates a year or two after graduation, so we think that's the best way to start a research career. So they have 2 years working with a researcher where they really start to get their research established. And then nurses really can't do research unless they write grants and get supported. So we wanted to know how many nurses actually submitted proposals. Unfortunately, of the 100% of the people that have graduated that we talked to, only 64% actually submitted a research proposal. And of those, only 45% actually were ever received funding. So that's a small number of PhD nurses that are actually doing research. And then another measure, of course, is the publications. Because once research is conducted, we have to disseminate it, right? Knowledge isn't knowledge until it's disseminated. And so we found that only 25%, so that's a fourth, of all people that graduate a PhD have never published. That's a stunning number. They didn't even publish their dissertation. And on the other hand, 5% have published more than 20 articles in a refereed journal. So we see here is 5% of the graduates are being very productive. And if you have a PhD program, all PhD programs are competing in the United States for that 5%. We want those really strong researchers to teach in our program, because that's a quality program when you have strong researchers with funding and with active programs of research that can mentor students. And then we have the presentations. So challenges for PhD education in the future is, the big one really is to recruit and retain talented faculty. We're always looking to recruit the stars. So in summary, I just want to say that we have a lot of challenges on the undergraduate and the graduate program. And in the United States, we're addressing these and we're really talking about a transformation in how we deliver care, and a transformation of nursing education, a transformation of healthcare professional education. We need to we need to increase the number of nurses that we educate. We need to strengthen the academic preparation. Most of the nurses that have a license in the United States do not have a baccalaureate degree. Probably only 30%, and we need to increase that percent. We need to develop new models of education, and in Boston we're developing, we're trying new pedagogies, new methods of teaching by flipping the classroom. And that's by, I don't know if you've heard of that now, but it's a very big thing in education in the United States. And it's flipping the classroom so that the professor is no longer the imparter of all knowledge, but that students actually do all the readings and do the exercises before coming to class. And they come to class and we work in learning teams so that the faculty and the students are learning together, right? So that's what's called flipping the classroom. And also we're doing a lot with simulation, and it's really, I've seen in our lab simulation, students, maybe 4 or 5 students going through a simulation crisis with a mannequin and all the meds and the videos and monitors, and it is really amazing to see the learning that takes place. And the really important thing about simulation is not just the simulation itself, but it's the debriefing after the simulation that's so important. So they spend as much time in debriefing, and if you have a skilled debriefer, somebody that's trained in debriefing that exercise, it is really wonderful to see how students learn and gain confidence. And some of the research around simulation says that you can replace the clinical experience. Up to almost 40 or 60% of clinical can be replaced with simulation. So that's pretty amazing. And then we're also trying DEUs, which is dedicated educational units in clinical settings. So, for example, at Mass General Hospital, a Harvard teaching hospital, we have a special unit set aside where we have nurses that work in the hospital are working with students more intensely in these special units. the regular patients and the regular nurses from the hospital. And I think that probably happens around the rest of the world, but it hasn't happened so much in the United States. So we're getting back to that. And it's one of the ways we can expand our nursing faculty by using nurses that are working in the hospitals. And then we really, in summary, again, I want to say that if we want to improve the health of the population, which I showed you, we really need to improve the health of the population, of some subgroups and the total population. And we need to focus more on promotion, prevention, and chronic disease management. Then we really have to transform nursing education. And I want to know that nurses have this responsibility. And we have that responsibility. We are part of the problem of the failures in the healthcare system. And I think we have to accept that burden or that responsibility. And then, because we're a part of the problem, we have to be a big part of the solution. Thank you.
Thank you. Now, Dr. Suhair.
Thank you very much. We are going to present Interprofessional Collaboration Addressing Community Needs by Professor Diane Shee, College of Nursing and Health Science, University of Minnesota, Boston. أهلا وسهلا.
Okay, salam alaikum. So I'm going to discuss about interprofessional collaboration, education, and practice, and how that can translate into the community. And these are just some of our students. More closer look at our campus, and on the top is, one of the graduation ceremonies, and that's always a great celebration, both for the faculty and for the students as well. I thought I would take a second. We'll see if this works. And it's a song in reference to triumph. And you've done many things and should be acknowledged. And as you continue to move forward, it's an inspiration. So it's a Rocky song. And so we'll see if it does it. If it doesn't, that's okay. Maybe won't. Okay, that's okay if it doesn't. Okay, you can only try. Oh, good, it's going to do it. That's okay, it just takes longer than it should. Oh, maybe it's not plugged in, is that it? Okay, that's okay. So anyways, I guess it needs to be plugged into a speaker. And the fact that it's not is perfectly fine. I should have asked before, so that's me. But I just wanted to acknowledge you've done a lot of great work, and you should celebrate the work as you continue on your journey to continue to do better and to continue to improve like we all do. Okay? Amen. Okay, so much for that. I can only try. So I want to talk about interprofessional education, and really with the education component goes the practice component as well. That's the goal, to practice this interprofessional collaboration within the practice setting. And there are some core competencies that were put together by a group of people, and one of the nursing components was the American Association Colleges of Nurses. So I'm going to cover some aspects of that. And I thought it would be helpful just to start with a definition of interprofessional education. And this is by the World Health Organization, and it's when two students from two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. And really the goal of it is, we have the same goal. The goal for all health professions is to maximize the health and well-being of patients, and working together helps produce better outcomes. So for interprofessional competencies in healthcare, integrated enactment of knowledge, skills, and values, attitudes that define working together across the professions with other healthcare workers and with patients, along with families and communities, as appropriate to improve health outcomes in specific care contexts. So not only do we work with other healthcare professionals, but we also partner with patients and their family members as well. It's a team, it's a comprehensive team as we work together. Barr has a competency and a model in reference to interprofessional. And the interesting part about it is for each of our professions, we have our competencies, our professional competencies. But even within those competencies, we do have the same values as well. So some things overlap. We do have common competencies. We want to care for the patient, respect the patient, maximize their outcomes. And so it all overlaps, and that interprofessional collaborative competencies is really where we work together, come to a common ground, and respecting each of our professions as we care for patients as we move forward. This is an interprofessional team work group that developed these core competencies, and I thought it would be helpful just to view it in the form of a picture. So at the center of it, if you see, it's work in interprofessional teams and core competencies. So we work together in teams. And as you work together in teams, there's lots of information that you need in order to make judgments, in order to care for the patient. Because in the end, it's patient-centered care. And if that's really the focus of it, it makes it easier to work together because we have that common goal. So in caring for the patient, working together, need to utilize informatics, which was discussed very nicely. We need to employ evidence-based practice. So what evidence do we use in order to practice and care for the patient? What's the latest evidence? Things change all the time, and so being current, and that's the exciting part of being a healthcare professional. We're lifelong learners, and so it always keeps it interesting. So being current is really important, and always apply quality improvement. So even though something works really very well at one point, there's always ways to improve it and make it better, and so to think in those terms is really helpful. This looks like a very complicated slide, but really it's fairly simple. So if you look at one side of it, it's the educational system, and if you look at the other side, it's professional system, and they interlink. And so at the center of the educational system is the learner and the educator. And the goal is to produce interprofessional education to enhance learner outcomes. That's the goal. So in academia, that's our focus. We want to produce nurse leaders, and then the aspect of which we teach is interprofessional education. And what we produce is health professional learners. Those are the outcomes. And as they go into practice in the hospital setting, the patient is at the focus. So as we collaborate with other healthcare professional team members, our goal is to care for the patient, and then the outcomes for that is a patient, provider, organizational systems. And there is an accreditation process for both. So for the educational system, we do have accreditation. Now accreditation agencies actually look at, and more are starting to look at interprofessional education, how we actually accomplish that. And the same for hospital organizations, for regulatory joint commission. They look at that as well. This I thought I would just take a second, just because I mentioned accreditations, is that this actually is a model that should, for us at home, go into effect in 2015. That's really the target date for it. So lots of work goes into it. And has gone into it. And for the advanced practice nurse, so someone who already has their bachelor's and they're seeking a master's degree, they're going to focus on 4 different areas. So the areas are nurse anesthetist, nurse midwife, clinical nurse specialist, and nurse practitioner. And then within the licensure of those degrees, there's a different focus for population. So you can focus on individuals across the lifespan, gerontology, neonatology, pediatrics, women in health, and psychology. That's the focus population. And then from that, you can actually go on to further specialties, and a specialty in reference to that One of them would be oncology, palliative care. So just to touch on those aspects of it for, regulatory part, since I did mention, some accreditation. To go back to the interprofessional education component of it, it looks like a complicated side. I'm just going to focus on the left side of it. And this is from the Medical University of South Carolina, and it's a conceptual framework of advancing interprofessional education. And through it all, you have to acquire knowledge, you have to apply it, and you have to demonstrate it. So that's the premise of it for each stage as you continue to go up to create collaborative care. So as an individual, you prepare yourself as a team member. Each of us has a role in that. You need to think of yourself as a team member, and I think it makes it easy always to think of the patient as the center and you working in order to help the patient. You have to practice as a team member and then certainly act as a team member and foster that component as well. This I'm just going to touch on. It has to do with core competencies in reference to interprofessional collaboration, but I think it mentions a lot of important concepts. So it's a coordinated effort. It's not only within the nursing department, but the goal at home, and I'll provide some examples, is in the medical school. They have a component of interprofessional collaboration, and we collaborate with them on different projects to kind of bring that whole concept to life. The goal is to guide the curriculum and to achieve outcomes. So embedded in the curriculum, if it's clearly defined, it really assists in achieving those goals. And then part of it is to have a foundation to understand, as nurses and any healthcare professional, we're lifelong learners. And I think, honestly, that's the exciting part about it. But even in the concept of interprofessional aspects of it, we're lifelong learners. You can always do things better in how you work towards that end. Contributing to knowledge is really important, nursing knowledge, healthcare knowledge, and so as we begin to do different aspects of interprofessional work, we want to evaluate it, look at the outcomes, do research, and then share that knowledge to continue to share that with other people as well. Promoting a dialogue is important. Accreditation, I mentioned, we have accreditation in AACN and CCNE, two accrediting bodies specifically for nursing, but even they're starting to look at putting in their standards or working towards putting in their standards addressing interprofessional education. And then the other component of, we take an exam as a nurse for baccalaureate degrees, and now the state board or the national board is looking at ways in which to define questions in order to test students on that. So that's forthcoming as well. I'm just going to give some examples, just kind of to bring it to life. I was involved with an organization, and it's an interprofessional activity, and we did it once a year. And we're involved with 11 different institutions across Pennsylvania, that's where I worked before, with 700 students, and we did it in a day. And it's a phenomenal experience. So, PAs, nutrition, social work, med students, nursing students, radiologists, a number of different healthcare professionals as students. And we get together once a year to do an interprofessional activity. And one of the interprofessional activities that we did had to do with a homeless person. So we taped and showed what was presumed to be a homeless person who had a bag with them, not